Hello, my name is Nick. I'm going to be performing a physical assessment on a stuffed animal. So, before I walk in, I knock, close the curtain for patient privacy. And hello, my name is Nick. I will be your nurse today. Can you start by telling me your full name and date of birth? Okay, great. Do you have any allergies, sir? No? All right, so I'm going to wash my hands per CDC guidelines and put on gloves. So, can you tell me where you are right now? Okay. Can you tell me your name again? And do you know the date today? Okay, and the President of the United States. Awesome. So what kind of mood? How did you wake up feeling today? Oh, great. So you don't have any plans to harm yourself, right? No suicidal ideations? Okay, good. That's great to hear. I'm glad to hear that. So, can you tell me, do you wear any hearing aids, any glasses? No? Okay. And patient speech is very good, A&O times 4, and no miscommunication. All right, so before I begin, can I ask if you have any pain today? On a scale of 0 to 10? No pain? Okay, so before I begin my physical assessment, I'm going to, do I have permission to touch you? Okay, great. So this is gonna be just to make sure that all your body systems are working. Do you have any questions about the physical assessment? No. Okay, so I'm going to begin. Have my supplies gathered. So I'm going to inspect the head for any infestation, masses, make sure the skin is intact, hair distribution, okay, palpate, make sure there are no masses. All right, so now I'm going to check the ears, pen light on, auricle up and back, minimal cerumen present, no drainage, no bleeding, ears, no tenderness, right? Do you have any tenderness in your ears? No. Okay, and ears are in place. Check on this side as well. Minimal cerumen present, no drainage, no tenderness, and ears are in place. All right. So now I'm going to go ahead and check on your eyes for you. So can you tell me, are you eye sensitive to light at all? No. Okay. So go ahead and follow the pen light. Okay, go ahead and focus as I bring it close. All right, now close your right eye for me. Pen light on. Pupil constricts. Go ahead and close your left eye for me. Pen light on. Pupil restricts. Okay, so in the overall face symmetry, skin color is consistent with ethnicity, no cyanosis, no paleness. And there are no facial drooping. Face is symmetrical. Okay, now I'm going to check the nose. Nasal cavity is patent, and there is no drainage, bleeding, or anything wrong in the nose. Okay, so go ahead and open your mouth for me and lift up your tongue. Pen light on. Okay, no swelling. Mucous membranes are moist and pink. No bleeding, no cracking, nothing of that nature. All right. So I'm going to check on your. Make sure you have check on your lymph nodes, make sure you have no swelling or infection signs. So I'm going to palpate here, so maxillary, palpate here, and there's no swelling noted. Okay, can you swallow for me? Palpate over the trachea. Okay, no tracheal deviation, patient can swallow, okay? And I'm gonna ask you to turn your head to the right. Assess for JVD, no swelling. Okay, now turn your head to the left. Pen light on, assess for JVD. No swelling as well. Alright. Now I'm going to palpate the head and neck, make sure there are no masses. And no masses were felt. Alright. So now moving on, I'm going to assess for skin color. Skin color is consistent with ethnicity, no paleness, no cyanosis. Check for temperature. Okay, temperature is warm. You're not feeling any extra hot or cold today, right? No? Okay, that's great to hear. Assess skin trigger. No skin tensing. So the patient is fine. All right, now I'm going to ask you to shrug your shoulders for me. Is there any pain or stiffness? No. Do you have any problems doing any regular activities with your shoulders? No? Okay, that's great to hear. All right, So now I'm going to palpate for any edema. No edema present. All right, I'm going to assess for any IV site tenderness and warmth. How did your IV site feel? Okay, good. All right, so now I'm going to ask the patient to squeeze my hand. Okay, very strong. Muscle strength is good. Okay, check capillary refill. Brisk on all fingers. And now I'm going to check bilateral pulse symmetry in the radial, in the ulnar, radial, and brachioradialis pulses. Okay, and no edema as well. All right, now we're going to move on to the chest. So first I'm going to inspect the chest for any barrel chest. Make sure it's symmetrical, no bruising, nothing of that nature. No chest wall tenderness, no pain. Okay, so now I'm going to clean my stethoscope. Okay, I'm just going to check your heart sound at your point of maximal impulse in the apical pulse, which is going to be the 5th intercostal on the midclavicular line. Okay, normal sinus rhythm, no murmurs, no bruise. Okay, and while I'm here, I'm going to have you take a deep breath when I put my stethoscope on your chest to make sure your lungs are okay. Okay, so do you smoke anything? No. Any other substances? No. What about any use of oxygen tanks? Nope. Okay, your lung sounds were clear and consistent throughout. So just palpating for any masses and tenderness. No, and you feel okay. All right, so I'm gonna have you turn around, sir. All right, inspect, spine is straight. No masses, no CVA tenderness. Okay, so now I'm going to assess the breath sound. So I'm going to ask you to do the same thing and take a deep breath when I put the stethoscope on your back. Okay, breath sounds were clear and consistent throughout. And do you have any cough today? No, okay. Alright, so now we're going to move on to the abdomen. First I'm going to inspect the abdomen to make sure that there's no scars, masses, bruising, anything like that. Okay, nope, there is none of that. So now I'm going to auscultate the abdomen. Before I do that, can I ask you when your last bowel movement was? Okay, and it was normal, not unusual, right? Do you have any nausea, vomiting, trouble eating? No. And what about urination? Any pain, burning, cloudiness? No, everything's fine with that. All right, so I'm going to go ahead and listen now. Starting on the right lower quadrant for 30 seconds. Bowel sounds were normal. Patient stated bowel movement was last recorded this morning. Now I'm going to percuss. Tympany is heard. Okay, now I'm going to palpate. Tell me if you have any pain. Okay, no rebound tenderness. Now I'm just going to go ahead and assess your perineal area. So can you just go ahead and relax? I'm going to check, inspect. No Foley catheter. Cleanliness is good. Nothing abnormal. All right, sir, I'm going to check on your legs now. So can you go ahead and lift your legs up as I push down? Oh, very strong. All right, now the other way, push it down. Okay, very good. So do you have any difficulty ambulating? No assistive devices, walker, anything like that. All right, so can you go ahead and lift your legs up, bend your knees, flex your hips? Okay, any pain or stiffness with that? No. Okay, so I'm just gonna go ahead and palpate for edema. No edema noted. Okay, I'm gonna inspect the calves for any redness or swelling. No. Do you have any pain in your calves? No. Okay, gonna do the pedis pulse symmetry. Okay, symmetrical popliteal pulse. Okay, and posterior tibialis pulse, and they are all equal. No pulse deficits. All right, so now I'm going to check for cap refill on all the toes, and it is all brisk. Okay, and pulses are strong. All right, so now I'm going to assess on bony prominences. Any pain? No. Okay, no edema is noted. All right, and now I'm going to assess for any balance issues. Do you have any balance issues, sir? No? Okay, I'm going to ask you to go ahead and stand up, and we're going to do a Romberg's test just to make sure, okay? So, the patient stands up and closes his eyes and puts his arms out and balances for 30 seconds. No trouble with that, so we're going to ask the patient if he has any trouble doing that at home, any balance issues at home, and he says no. Okay, so legs are symmetrical and everything in the legs is all right. So, sir, do you feel safe here right now? Yes. Okay. Do you feel safe at home? Yes. Okay. Well, sir, that concludes the physical assessment for today. Thank you for your time. I'm just going to go ahead and put you back in bed and put the guardrails up, bed rails up, bed down, brakes on, and call light within reach. And now I'm going to, wash my hands per CDC guidelines, provide patient privacy, and leave the room.